My name is Tom Brunner, and I'm the president and CEO of Glaucoma Research Foundation. And I have to say, it is so great to see all of you here in person. So thank you for being here, and thank you for your attention. I think you're going to find the meeting today to be very informative, and we welcome your questions and welcome your participation. And I look forward to getting to meet many of you during the course of the day. I'd like to especially thank our sponsors, our platinum sponsors, Aerie Pharmaceutical and Santen, and their generous support, along with our other sponsors, really helps to make this meeting possible. I also would like to mention, and I think you'll all appreciate this, that we have 10 companies represented here with more than 28 attendees. So they are really interested in what you have to say and your questions, and they're learning just as you are learning, and we're all learning together. And it really is exciting to see the level, and many of them are senior executives, and they are interested in finding better ways to help you live with and deal with glaucoma. So if you see them, thank them for being here, and I know they really appreciate your being here and learning from you as well. Now, we do have an amazing program. I'm sure you've seen it on your table. We're including top glaucoma specialists who will highlight some of the most advanced technologies and new developments and practical information for patients living with glaucoma. And we basically hope that when you leave the meeting at the end of the day, that you'll have some new knowledge that you can use to help yourself and to help others, maybe make some new friends, I hope. And certainly, if you're a patient or a caregiver, that there'll be something you'll be able to take away that will help you deal better, more effectively with your glaucoma. Now it's my special privilege to present today's host, Dr. Inder Singh, a very good friend, and I know he'll be a good friend of yours by the end of the day. He's got more energy than the whole room put together, as you will soon see. Dr. Singh is the president of the Eye Centers of Racine and Kenosha in Wisconsin. He graduated from the Chicago Medical School and then completed his glaucoma fellowship at Duke. And he is a dedicated ophthalmologist, and that's an understatement, I think. He lives ophthalmology and lives for his patients and lives really to learn about the very latest things that are going on and then to do the clinical research to bring these new products to actual clinical use with patients, which is such an important part of the whole process of innovation, having people with Dr. Singh's skills and interest that can help to bring these really to the patient. So we're really delighted to have him here, and thank you, Paul, and I'm going to turn the program over to you. So please welcome Dr. Inder Singh.
Thank you. Thank you, Tom. Wow, that was a great intro. Thank you for that. I really appreciate the opportunity to be involved. Thank you for all the hard work that you and Michelle and Nancy and the whole GRF team does every day. And it's been an honor to be here, to see all of you here as well, live in person, which is fantastic out here in Chicagoland area. By the way, how many people here are from Illinois, Chicagoland? Oh, we have a good amount. How many people everyone else outside of the area? Great mix. That's fantastic. That shows the interest. And thank you, everybody. We have someone from the Ivory Coast, I believe, as well. So thank you for being here as well. And then that's the idea. As Tom mentioned, why I'm so honored to be here and why I love working with GRF is this kind of quest to constantly learn. There's so much more we have to learn. And the more I learn about glaucoma, the more I start treating patients with glaucoma and hearing from my patients, the more I realize how much more I have to learn. And this quest to keep learning, to keep pushing forward, is really what the emphasis emphasis is for GRF and the education part of it, bringing patients, bringing doctors, bringing companies together to find a way for all of us to work together to find a better way to live and manage and hopefully someday cure glaucoma. And that's where the emphasis is as well. So thank you for all the hard work there. And I'm excited for today. I think it's going to be a fantastic day. I don't have COVID. I'm COVID negative, but I do have allergies. So if I take a sip of water every once in a while, that's because I get a lot of congestion sometimes. But I appreciate the opportunity to be here and want to also just make sure we have some housekeeping things taken care of, first of all. I know we all love Wi-Fi, and we all need to have Wi-Fi at all times. So I want to thank Sight Sciences for supporting the Wi-Fi here. So the network to access Wi-Fi is Patient Summit, and then Omni Surgical is the password. So if you want to have Wi-Fi the whole time, you're welcome to have it there as well. And we do want this to keep us interactive. That's the most fun part of these programs, is to have this interaction, to hear from you. What are the questions you have as patients living with glaucoma, dealing with glaucoma, and how can we help as well to answer those questions? So there's actually on your tables a QR code. You can use your phone and you can submit questions with the QR code. If you don't want to do that, it's too hard with their phones, there's actually on the back of those cards, you can actually write your questions down. There'll be someone picking up those questions and bringing them up here, and we'll be able to answer as many questions as possible. If we don't answer all the questions, I apologize, we'll do our best, but we make sure that all the GRF team reads every question. So hopefully in the future, we have other programs, we'll incorporate those questions into future programs, because we want to make sure all your questions are answered as well. So please feel free to ask questions, ask away as well, and that's very important.